Good day. I am Dr. Wilfredo S. Tagle, urologist, and welcome to Medical PracTIPS. It is a series of tips and tricks that will help you improve your medical practice. For today's episode, we will be discussing the art of breaking the news. How do you give or communicate to your patients the possible outcome of your patients? How to properly tell your patients their diagnosis and the overall conditions and prognosis of your patient. There are 8 steps in breaking the news. Number 1 is timing. Dapat sakto ka sa timing. Everything is timing. Timing is very important. It can make or break the condition of the patient and their relatives. Be sure that the patient and their relatives are properly notified before you break the news and will be talking to them. Make adequate time and preparation for this event. Inform them during, before, appropriate timing is being planned for. For the second step is preparation. Of course, you have to prepare everything so it would go and run smoothly. Before meeting with your patients and relatives, do a thorough review of the conditions and updates of the patient. Prepare a comfortable area for the patients and their family and for the discussion. As much as possible, an adequate area, comfortable room for them. Prevent any distractions from happening. Huwag yung maingay na lugar. Huwag yung maraming dumadaan. During the discussion, place your phone on silent and, if possible, turn them off. Avoid disruptive and noisy environment. For the third step is the current condition of the patient. Based on the family's assessment, ask for their thoughts on how the patient is doing and how are they coping up. Nag-i-improve ba ang patient? Gumaganda ba ang pakiramdam? And naka-adjust na ba ang buong pamilya? Now, for the fourth step is evaluation. Evaluate how much they want to know about the condition of the patient. Do they really know what's happening to their patient? Or the patient itself, does he really know? But as much as possible, if it is a bad news, don't involve initially your patient on the conversation. Some patients may not be aware or ready to hear everything and are just worried about what is going on. Going to the fifth step is the impression. After explaining the present situation, assessment of the patient, now they are ready to hear your impression and your evaluation. If they are ready, explain to them your diagnosis and avoid using medical jargons or masyadong malalalim na terms in medically. Give them the possibilities of what can happen in the future. Always give them cope as much as possible. Going to the sixth is empathy. Empathy is very important to the patient and to their family. Help the family recognize the current situation and the possibilities that would happen to their patients. Share the facts with both understanding and compassion. Let them feel that you are one with them. Okay, now going to the seventh is options and support. After giving the diagnosis, give them the options of what to do and your possible supports. Discuss the corresponding action plan and help the family come to terms with the patient's condition. Give possible supports and plans to the family like counseling, home care, and other financial supports that could be availed of by your patients. For the eighth step is agreed plan of action. After discussing everything, explaining to them and made sure that they know the situation of the condition of the patient, you discuss all possible plans of action, help the family agree on a specific action plan and direction of treatment. Ensure that they fully understand the pros and the cons of the situation. Let them know that whatever happens, they can always go back to you. You're just a phone call away. You're just in your office for any further available support that they may need. Okay, so those are the discussion for today. Turn in every Wednesday at 7 p.m. for the latest episode of Medical PracTIPS. See you! Bye-bye!